President-elect Joe Biden walking off stage after giving his address on his plan to address the economic and health crisis that we face right now due to the coronavirus pandemic. He said we have to act, and we have to act now. He called the current vaccine rollout, as it has been done so far by the current administration, a dismal failure so far, and he laid out what he would do differently. Still with me, Dr. Vin Gupta. Also joining us is Lois Pace, a member of President-elect Joe Biden's COVID-19 Advisory Board. Before I get to you all and let you give your reactions to it very quickly for our audience, to summarize, Joe Biden planning to put in $1,400 additional dollars on top of the $600 people already received. He has some other proposals, including raising the minimum wage to $15 an hour nationwide, asking Congress to extend the eviction and foreclosure moratoria, and adding a SNAP increase for those who are hungry. On the rescue side, on the COVID side, $20 billion for a national vaccine plan, launching community vaccination centers, $50 billion for testing, adding local places for people to be vaccinated, $10 billion for vaccine supplies. I want to go to you, Dr. Gupta. From what you heard about that side of the plan, the vaccine side of the plan, what did you make of it? What did you think?
Joyce, it's the type of think big disaster mindset that we've needed all along since the beginning of 2020, and I'm glad that we're seeing it now. We need more places for Americans to get shots and more people, frankly, to administer those shots. So some sort of train the trainer program where you don't have to be a healthcare worker necessarily to give a vaccine. We have people giving insulin to themselves all the time. We need to think big here. So I'm encouraged by that. We need to mobilize, I say this as a reservist in the Air Force, that we need to mobilize our military, not just expecting governors to mobilize their National Guards, but mobilize the federal military assets that they have at hand. So that's going to be vital as well. And if I could quickly, Joy, just say, this is where messaging is going to be key. Now we have a president who's going to be messaging on point to the science and the evidence. And I'm hoping the governors across the country are paying attention. When it comes to schools, I'm hearing from teachers unions, why are we going back into in-person instruction with a new mutant strain that's more transmissible when we could be adversely impacted? Teachers deserve to be vaccinated. Alaska Airlines just said that they're going to start flying at full capacity. No more middle seats can be blocked out. That makes no logical sense. What happened to social distancing? We need private sector partners to play their part here. Governors in 45 states still continue to have indoor restaurants open. Again, we need them to be partners with the Biden administration so we have common sense policies so that we can really decrease transmission until the vaccination process really ramps up by the spring.
You know, and that is an excellent point. And Lois Pace, I want to bring you in here. I mean, at this point in our country, we have 23 million people who are infected with COVID. 388,000 people have died. Among the infected, we just got another member of Congress, Adriano Espaillat of New York, also testing positive. The vaccine rollout so far has been slow. 11 million people have gotten those shots, 30 million doses distributed. That's a pittance compared to what we were promised. And I wonder, as you listened, and obviously you're a part of this plan, why roll this out in February? Why not make this immediate in the first days of the new Biden administration? And why not, as Dr. Vin Gupta said, include enlisting the military in getting this vaccine out, having teachers, maybe training people in schools to also be vaccinators so that we can make this happen faster for teachers and other vulnerable workers?
Well, some of that is actually happening, Joy. So I'm really appreciating you and Ben both raising it. We absolutely need to bring the full breadth of our capability to bear, and that includes working closely with these very communities and leaders in those communities to make that happen. So as you mentioned, there is a commitment to bringing on board more community health workers. I think the plan cites 100,000 community health workers. There's also an acknowledgement that there are even more people beyond that number working with local networks, clinics, community-based organizations who could be of assistance, and absolutely thinking of this as a disaster plan. And there's absolutely a commitment to bringing in the National Guard as the states need them. And not only that, but fully funding that on behalf of those states if required. And so I think what I'm impressed by is the fact that the president-elect is bringing the full resources of the federal government to bear, or is at least wanting to do so as he steps into this role. To your other question about timing, I think the reality reality is we have next Wednesday as a starting point, but there's still some things that we don't know, and we don't want to act too prematurely. We don't want to rush into this and continue to make mistakes in the process. I think the team going in needs to truly understand what they're dealing with, because there's still some things that they might not know. But I am encouraged by all the conversations that the advisory board and transition staff have been having, again, with those state, local, and tribal leaders to truly understand what they need. And I think that this is how the president-elect and vice president-elect is trying to step up.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.